Bruce, Acting Executive Director of Medical Services, Murrumbidgee Local Health District. Welcome everyone to our weekly COVID-19 update for the Murrumbidgee Local Health District. Once again, lots of good news this week. The total number of cases remained the same at 45, so luckily no new cases for us since last week. And the other bit of good news is that the total number of recovered patients are now 40. So that's really going well for us. We have no patients in hospital with confirmed COVID-19 disease and obviously no patients in intensive care. Once again, we would like to thank the community. We know it is taking a lot of sacrifices from them to keep everyone safe, and we do appreciate their efforts and people maintaining the social distancing, and especially with the change in rules over the weekend, we still request that people remain sensible to make sure that they keep themselves and their loved ones safe. Just an update. There is a focus on extended testing, and the total number of tests conducted is now 3,967, and that's 680 in the last week, which is really great. And the Murrumbidgee Local Health District will be starting mobile testing clinics next week, and the areas that will be visited will be Lockhart, Henty, Coolamon and Narrandera. And those appointments can be made through the Murrumbidgee Local Health District COVID hotline. And we really ask people with any symptoms to come forward for testing. And what we would also like people to do, if they have an unexplained loss of smell or change in their ability to taste, is actually very subtle signs that can point to COVID-19 disease. And even if you just have that, contact us and present yourself for testing, because I really think it's an important part of our strategy going forward. Now, the community will be aware that there is a focus to have a reintroduction of elective surgery. Now, just to provide some more information, in April, Wagga Base Hospital has done plus minus 80% of our regular surgical activity, which is a combination of emergency work and elective surgery. But we're in the process of reintroducing 25% of the lists that have been deferred as part of the pandemic response. And that will happen, in the next week or so. And the one other important component of that, though, is that there will be certain additional steps that need to be taken to make sure that patients are kept safe, social distancing is maintained. And one example would be is that we may or may not do their patient's pre-op assessment via telehealth, and there will be certain other requirements that we will discuss with patients when we arrange their upcoming surgery. Now, any questions for me?
That one person that has recovered, whereabouts are they from?
So there were 2 extra, I think. We're at 40 since last week. And I must say I don't have that detail. It will be in our media release, but I don't think it's somebody from Wagga, but there's 2 extra recoveries.
Are we still speaking to the infectious disease?
Yes, so if you've not got no questions for me, very good. All right, so I'll like to introduce Dr. Tim Gilby, who's our infectious diseases specialist, and I thought that he could give an update about testing, because we've had some questions about false positive and false negative testing, and I thought I'd get an expert to come and answer that for you, and he'd be happy to take some questions. Dr. Gilby.
I'm just wondering, if I can just ask one question. The telehealth, the monitoring at home, what are the pluses and minuses with that? Has there been any teething issues, or has it all worked relatively well?
So the one issue that we had with the telehealth is that we actually didn't have patients that would fall into that category. But what we're in the process of doing is validating the monitors on inpatients, and that will be done in the next 2 weeks. to make sure that the information flows accurately into our system. And the benefit is we can then compare that information with data that we collect already for inpatients, and to make sure that the validation process is secure before we roll that out to patients in the community. Thank you.
Thank you.